Wake up, prepare your brain for gynecologic emergencies. Gynecology is the branch of medicine that studies health of the female patient and her reproductive system. Female patients who experience gynecologic problems often complain of abdominal pain and vaginal bleeding or abnormal discharge. This pain, bleeding, or discharge may be attributed to various conditions that can be life-threatening. Conditions causing abdominal pain in pregnancy patients will be discussed, blah, 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 blah. Female reproductive structures and functions. Let's go. Female reproductive structures and functions. I just said that. The female reproductive system is composed of external genitalia and internal organs and structures. The female external genitalia, also called the vulva. What is the vulva? The female external genitalia. It consists of vascular tissues called the perineum, the mons pubis, the labia, and the clitoris. The vulva provides accessory functions to the internal organs that are used primarily for reproduction. The internal organs of the female reproductive system are the vagina, the uterus, the ovaries, and the fallopian tubes. The vagina functions as the birth canal during childbirth. What is the vagina? The birth canal receives the penis during sexual intercourse and serves as a passageway for menstrual flow. The ovaries are the primary sex glands located on each side of the uterus. What are the ovaries? They are the primary sex glands located on each side of the uterus. All right? They excrete hormones and develop and release eggs that are needed for reproduction. The fallopian tubes extend from near each of the ovaries to the uterus. Fertilization of the egg normally occurs here. Okay, let's read that again. Fallopian tubes, what do? They extend from near each of the ovaries. They extend from near the ovaries to the uterus. The fallopian tubes go from near the ovaries to the uterus. Fertilization of the egg normally occurs where? In the fallopian tubes. All right? Fertilization of the egg normally occurs in the fallopian tubes. The uterus is the pear-shaped muscular organ that provides an appropriate site for egg implantation and fetal development during pregnancy. The uterus is the pear-shaped muscular organ that provides an appropriate site for egg implantation and fetal development during pregnancy. The uterus is lined by the endometrium, which is sloughed, sound like slough, spitting all over this damn book. The uterus is lined by the endometrium, which is sloughed off during menses, or the menstrual period. Another word for menstrual period, menses. Gynecologic conditions. Blah, 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 blah. All right, it's explaining. All right, well, this section presents an overview of some of the most common gynecologic conditions that may cause abdominal pelvic pain or bleeding. All right. These conditions can have either medical or traumatic causes. Gynecologic conditions can result in life-threatening complications if left untreated. Remember that you should never spend, what should you not spend time doing anyway? Remember that you should never spend extended time at the scene trying to determine the exact cause of acute abdominal pelvic pain. You should just get the fuck on, all right, because they're hoiting. Sexual assault, and it could be something major. Sexual assault is an act of violence and a crime that is defined differently by each state. Most definitions include sexual intercourse or other sexual activities that are performed without consent. Anyone can be a victim of sexual assault. However, women are victims more frequently than men. Most victims of sexual assaults know their assailants. However, Many will not report the activities to the authorities. As an EMT, you are required to report sexual assault cases to the proper authorities or shoot them in the back. Okay, you can, if you got the strap on you, hey, street justice. Somebody gonna hurt them. Make sure you follow your local protocols when dealing with a sexual assault patient. The effects of rape or sexual assaults are both physical and psychological. Physical effects may include traumatic injuries from beatings, chokings, and penetrations, swelling, bleeding, and pain around the genital or rectal area, sexual transmitted diseases, STDs, possible pregnancy. Psychological effects may include severe anxiety, depression, or fear, inappropriate feelings of guilt, flashbacks or nightmares, emotional withdrawal, numbness, or irritability. It is important to provide emergency care that addresses both the physical and the emotional needs of the patient. It is also very important that the victims of sexual assaults are evaluated at the hospital, that any evidence related to the crime is preserved to the extent possible. The following guidelines can be applied to the EMT when a sexual assault has occurred. Do not allow the patient to change clothes, bathe, comb, or clean any part of their body. If the clothing was changed, collect it, bag it separately, and take it with you. Do not cut through any holes or tears in the patient's clothing. Handle the clothing as little as possible to preserve evidence, of course. Do not touch or change anything at the crime scene unless it impedes emergency medical care. Do not clean wounds if possible. What the hell are you there for then? Anyway, treat wounds as you would other soft tissue injuries. Do not examine the genital area unless there is a life-threatening hemorrhage. Minor bleeding can be absorbed by a pad. Make sure all bloody articles smell that breath. Make sure all bloody articles are collected and transported with the patient. When caring for a patient who has been sexually assaulted, it is important to remain non-judgmental and objective. Provide a safe environment for the patient. Always maintain patient confidentiality and ask only questions that are pertinent to assessment and emergency medical care. When interviewing the patient, it is not necessary to question him or her about the specific details of the crime because your treatment will be based on your assessment findings and your patient's current presentation. Do not touch the patient without consent or unnecessarily. Respect your patient's wishes and privacy. Obtain vitals and evaluate any other associated injuries that may have occurred. Document all findings objectively and accurately. Vaginal bleeding. This is non-traumatic. All right. Vaginal bleeding in female patients may be caused by cancerous lesions, pelvic inflammatory disease, hormonal imbalances, spontaneous abortion, or it's called a miscarriage, of course, or labor. Vaginal bleeding in female patients occurs naturally with normal menstruation. However, the EMT should not assume any bleeding is occurring from menses. In girls aged 10 or older, menarche, MENARCHE, or the onset of menses could be the cause of bleeding. The most common cause of non-traumatic vaginal bleeding other than menses is a spontaneous abortion or miscarriage. Women of childbearing age, of course, are most at risk for a spontaneous abortion. Hey, these yawns won't leave me be. Women of childbearing age, of course, are most at risk for spontaneous abortion. However, menopausal women can also become pregnant and experience spontaneous abortions. All right? That's the, the rule or the exception, that is. That's that exception word, of course. When you hear however, we about to make another exception, all right? Women of childbearing age, of course, are most at risk for spontaneous abortion, all right? But, however, menopausal women can also become pregnant and experience spontaneous abortions, though. More than 20% of women who are less than 20 weeks pregnant will have vaginal bleeding. More than 50% of these pregnancies, pregnant women with vaginal bleeding will be having or have had a spontaneous abortion. Regardless of the cause, vaginal hemorrhage can be life-threatening and should be treated as such. Common signs and symptoms of a spontaneous abortion: lower abdominal or pelvic pain, abdominal tenderness, vaginal bleeding, rapid pulse, and signs and symptoms of shock. Why? Why do they have signs and symptoms of shock? Because they have volume loss. I'm saying it again. Menstrual pain. When the endometrial lining of the uterus is sloughed off during menses, it can be accompanied by strong uterine cramps that cause a severe pain during menstruation called dysmenorrhea. Dys is difficult, of course. You got the men in there, I guess that's the menses, or, the cycle itself. And you got the rhea, flow, so it's a disruption of the flow, I guess. Let's see. See if I'm right. Dysmenorrhea is normally caused by hormonal imbalances or other gynecologic conditions. Occasionally, a patient may experience abdominal pelvic pain in the middle of her menstrual cycle. This pain is called Mittelschmerz. Mittelschmerz, German for middle pain. Mittelschmerz. Okay, they didn't explain dysmenorrhea, but we can, break that word down ourselves. But anyway, Mittelschmerz, German for middle pain. It is caused by irritation of the peritoneum by the small amount of bleeding associated with the rupture of ovarian tissue that occurs with release of the mature ovum. Remember that abdominal pelvic pain, regardless of the cause, should be treated as an emergency. Don't be no sucker. They ain't got nothing to do with nothing. But anyway, ovarian cyst. An ovarian cyst is a fluid-filled sac that forms inside or on an ovary. It is formed during ovulation when a follicle containing the egg fails to open as it is supposed to. Ovarian cysts can cause abdominal pelvic pain if they rupture, twist, or break open and leak their contents into the abdomen. However, most ovarian cysts are asymptomatic, which means A is with none or whatever, have no symptoms, all right? Most ovarian cysts have no symptoms, so I don't know what we're going to do with that one. But anyway, common signs and symptoms of an ovarian cyst here: unilateral abdominal pelvic pain that may radiate to the back. Most ovarian cysts have no symptoms. Okay. Unilateral abdominal pelvic pain that may radiate to the back, abdominal tenderness, vaginal bleeding that may be irregular or abnormal. I need a whole man nap. Pain during sexual intercourse or bowel movements. That's the last common sign or symptom of an ovarian cyst. Although most ovarian cysts have no symptoms, they are asymptomatic. Endometritis is an inflammation of the endometrium. It is most commonly caused by an infection. However, it may also occur from childbirth, abortions, gynecologic procedures, or intrauterine devices. If left untreated, endometritis may lead to peritonitis, abscess formation, septicemia, shock, and infertility. If endometritis is left untreated, it could lead to other conditions such as abscess formation, septicemia, shock, infertility, and peritonitis. Common signs and symptoms of endometritis include abdominal pelvic pain or tenderness, as with all of them it's the same. Abdominal pelvic pain or tenderness, fever, abdominal distension, vaginal bleeding or discharge, discomfort during a bowel movement. All right. Now we have something similar to endometritis, but this one is endometriosis, all right? Of course, the itis is inflammation. The osis is a condition of, if I'm not mistaken. But anyway, endometriosis is a condition in which endometrial tissue grows outside the uterus. The most common sites for endometrial tissue implantation are the abdomen and pelvis. But the tissue can be implanted anywhere in the body. But the most common spots you have are the abdomen and the pelvis. The endometrial tissue can bleed into the surrounding area and may result in inflammation, scarring, pain, and adhesions. Endometriosis is most commonly diagnosed in women who are 25 to 35 years of age. Common signs and symptoms of endometriosis: abdominal pelvic pain or tenderness that may be dull or cramping, dysmenorrhea, vaginal bleeding, pain during sexual intercourse or bowel movement. Some of these signs and symptoms they're damn near the same shit, man. Damn near. All of them are close, are very closely related. That's why I guess if the person is feeling some kind of pain, you don't even try. Because it could be a number of things, Anyway, pelvic inflammatory disease, or PID, is an infection of the female reproductive tract. Pelvic infections are caused by bacteria, fungi, or viruses. The majority of these infections are caused by the same bacteria that lead to STDs. Damn, the sleep hit me. The majority of these infections are caused by the same bacteria that lead to sexually transmitted diseases. But we got to wake it up, man. It's on. You need to be absorbing this shit. Wake up. Wake up! Approximately 1 million women will develop PID, or pelvic inflammatory disease, each year. 1 million. That's a lot. Although this condition is spread most often during sex, it can also result from a gynecologic procedure, insertion of an intrauterine device, childbirth, or an abortion. Risk factors associated with PID include sexual activity during adolescence, multiple sexual partners, unsafe sexual practices, a recent gynecologic procedure, insertion of an intrauterine device, and the history of STDs, or pelvic inflammatory disease. Wait. Risk factors associated with pelvic inflammatory disease. What the hell? Hold on, y'all. This shit say risk factors associated with pelvic inflammatory disease include sexual activity, everything I just read. And then at the end it says, and a history of sexually transmitted disease or pelvic inflammatory disease. Okay. Anyway, maybe I'm tripping. I don't know. But that shit don't even make sense to me. If left untreated, pelvic inflammatory disease can lead to scarring, infertility, or sepsis. Although some patients may be asymptomatic, they have no symptoms, most patients with pelvic inflammatory disease will have abdominal pelvic pain. Common signs and symptoms of pelvic inflammatory disease: abdominal pelvic pain or tenderness, vaginal discharge with an abnormal color, consistency, or odor, fever and chills, anorexia, nausea or vomiting, irregular vaginal bleeding or cramping, or pain during sexual intercourse. Let's talk about them STDs. Keep them STDs the fuck away from me. Rah! Sexually transmitted diseases. Sexually transmitted diseases, STDs, are infectious diseases that are transmitted through sexual contact. Over 300 million new cases of treatable STDs are diagnosed each year. Damn! Wrap it up, man. Most sexually transmitted diseases are caused by bacteria, viruses, parasites, or fungi. Chlamydia and gonorrhea are the most commonly reported STDs. Most commonly reported, they say. That's the key. It's reported. Some people ain't reporting this. Some of the most frequent sexually y'all be careful out there in these streets, man. Shit real out here. Some of the most frequent sexually transmitted diseases and their causes are listed, blah, blah, blah. The treatment for an STD is normally based on the type of organism that causes the infection. Patients at risk for developing STDs are those who have multiple sexual partners, do not use the condoms, or have a history of previous STDs or PID. There you go with that history again. There you go with that history. It's like a given. I don't know why they... Anyway, although some patients with STDs remain asymptomatic, others may complain of abdominal pelvic pain and other symptoms. If left untreated, some STDs may lead to sepsis, infertility, abscesses, peritonitis, or other systemic illnesses. It is important to note that the patient and the patient's sexual partners should receive treatment for these conditions. Hell yeah. Common signs and symptoms of STDs, you ask? Well, I'm about to tell you. And check your drawers. Shit. Abdominal pelvic pain or tenderness. Vaginal discharge with an abnormal color, consistency, or odor. Fever and chills. Nausea or vomiting. Irregular vaginal bleeding or cramping, pain during sexual intercourse or urination, genital itching, redness or swelling, lesions or ulcers. If you feeling any of that, you might be fucked up. Moving on. Assessment-based approach. Gynecologic emergencies. We ain't going to read about a scene size up. Of course, you're going to do that. You're going to do your primary assessment after your scene size up. And during your primary assessment, you're going to, the patient with acute abdominal pain or vaginal bleeding as a result of a possible gynecologic emergency should be categorized as a priority for transport if she meets any of the following criteria. Poor general appearance, which of course they're not talking about clothes and shit. Unresponsive, responsive but not following commands. Severe pain or shock. When you're doing your secondary assessment, during your history, ask the following questions. What are the signs and symptoms the patient is complaining of? Did the signs and symptoms seem to get progressively worse or better? How long has the patient been sick or suffering from these signs and symptoms? Was the onset of signs and symptoms gradual or sudden? What was the patient doing prior to the onset of the complaint? Does the patient have any known allergies to medications, food, or other substances? This is basically, it seemed like your sample in your OPQRST, but let's go. When did the patient last have something to eat or drink? What did she eat or drink? What medications, prescriptions, and non-prescription? What? Okay. Is the patient taking? Is she taking birth control pills or other contraceptives? What is the patient's past medical history? When was the patient's last menstrual cycle? Does the patient have any vaginal bleeding? If so, how much and for how long? How many pads has she saturated? Is there a possibility that she is pregnant? Has she been pregnant before? Does she have any vaginal discharge? Has the patient had any nausea or vomiting? Does the patient have any pain associated with urination, defecation, or sexual intercourse? Signs and symptoms once again. The signs and symptoms associated with gynecologic emergency will vary depending on the cause, right? We know that, right? But they all have a lot of similarities, but they're about to ball it up, all of them right here in one bundle. All right, abdominal pelvic pain and vaginal bleeding are two of the most common signs and symptoms associated with gynecologic emergency. Abdominal pelvic pain and vaginal bleeding are two of the most common signs and symptoms associated with a gynecologic emergency. Others include vaginal discharge with an abnormal color, consistency, or odor, abdominal pelvic pain or tenderness, nausea and vomiting, fever or chills, syncope, fainting, irregular vaginal bleeding or cramping, pain during sexual intercourse, urination, or bowel movement, irregular vaginal bleeding or cramping, vaginal pain, genital itching, redness or swelling, and signs of shock. All right. Emergency medical care for somebody experiencing some gynecologic emergency. You're going to maintain manual spinal stabilization if trauma is suspected, of course. You want to keep the airway patterned, that's always. If breathing is adequate, administer oxygen based on the SpO2 reading and patient signs and symptoms. If the SpO2 reading is greater than 95% and no signs and symptoms of hypoxia or respiratory distress are present, oxygen may not be necessary. In this case, you may choose to apply nasal cannula at 2 to 4 liters per minute. Why? Because you never withhold oxygen. So I don't give a damn. You got to give them something. Give them something. Nasal cannula at 2 to 4 liters LPMs. Give them something. Control any major vaginal bleeding if present. Place the patient in a position of comfort if no trauma is suspected. Calm and reassure the patient, Initiate a quick and efficient transport. That's what it is. That's what it is, man. You know. And, of course, you're going to reassess that patient every 5 minutes. That's for a trauma patient. All right, genitourinary renal emergencies. Urology is the branch of medicine that studies what? You know what it is, all right? Your urinary system in females and the genitourinary system in males. You got that? That's the difference. The females have a urinary system, males have a genitourinary system, all right? And urology is the branch that studies them there, all right? Those things there. The organs of the female reproductive system are separate from those in the female urinary system, of course. However, in males, some of the structures are shared. Why? Because of this, the term genitourinary system is referred to in males. Got that? Patients with genitourinary or renal conditions frequently experience abdominal pelvic pain. So if you have a question, shit, say something about some genitourinary and they're not real specific, you know what I mean? They're talking about a man. All right? That might help you. And if they just talking about a urinary system, more than likely they're talking about a female, all right? But, of course, there can be some exceptions with that if they just say urinary. All right, genitourinary / renal structures and functions. We're about to learn about the piss bag. The urinary system is composed of the kidneys, the ureters, the urinary bladder, and the urethra. The urinary system produces, stores, and eliminates urine from the body. The kidneys are bean-shaped organs. Beans, I'm hungry. Bean-shaped organs located in the retroperitoneal space. Where in the fuck is the retroperitoneal space? If you don't get this right, I swear I'll slap the shit out of you right now. The retroperitoneal space is the retroperitoneal space, because even I can't remember, but I know what it is. Of course, it's behind the organs in the front. So yeah, all right. The kidneys filter the blood and excrete waste products in the urine. They also play a role in homeostasis by regulating the body's pH. Hold on, I can't move on because I'm feeling myself right now. I can't remember what the hell the retroperitoneal space is, and I'm about to go look. All right. All right. That's right. Here goes a reminder for all of us. Shit, I'm talking to me, myself, and I. That's 3 people. The retroperitoneal space is hence the term retro. Retro means back, retro J's and shit like that. Anyway, retroperitoneal space is behind the peritoneal space, which is, basically the abdomen, a portion of the, place in the abdomen. But anyway, retroperitoneal space is behind the peritoneal space. All right. Oh shit, I just lost my page. Hold on. That's right. Here we go. All right, I found my spot. But yeah, the kidneys are in the retroperitoneal space located behind the, stomach and intestines and all of that stuff. That's why it's retro. All right. The kidneys are bean-shaped organs located in the retroperitoneal space. The kidneys filter the blood and excrete waste products in the urine. They also play a role in homeostasis by regulating the body's pH, acid, base levels, and electrolytes, controlling the blood volume and regulating the blood pressure. The ureters, don't slip on that. The kidneys help regulate the blood pressure. I always forget that because I didn't know that because I didn't remember that shit. Anyway. Let me go back. The kidneys filter the blood and excrete waste products in the urine. They also play a role in homeostasis by regulating the body's pH and electrolytes. All right. They control the blood. They help control the blood volume, and they regulate the blood pressure. The ureters are the tubes that carry urine from the kidneys to the urinary bladder. The ureters are tubes, all right? The ureters carry urine from the kidneys to the urinary bladder. The urinary bladder houses the urine until it is eliminated from the body via a duct called the urethra, all right? In women, the urethral opening is anterior to the I was going to say vagina. In women, the urethral opening is anterior to the vagina and excretes urine. However, in men, the urethra is located at the tip of the penis and eliminates both urine and male reproductive fluid. The organs of the male reproductive system include the testes, your balls, epididymis, I don't even know, epididymis, vas deferens, prostate gland, and the penis itself. The testes are the primary male reproductive organs. They produce sperm cells, which are necessary for reproduction and are stored in a small sac called the epididymis. Okay, well, there it is. That's what the epididymis is, all right? The epididymis is a small sac inside your ball sac that stores your sperm cells. Got that? All right. In order for the sperm to leave the body, it passes through the two ducts called the vas deferens. And that's what the vas deferens is, those ducts that the sperm cells pass through when they're on the way from your epididymis. The sperm then mixes with fluid from the prostate gland before it can be ejaculated from the body, spontaneous combustion. The prostate gland surrounds the male urinary bladder and houses the first part of the male's urethra. The penis is the male organ used for sexual intercourse and urination. Boy, they really break shit down, don't they? They act like they had to put that shit in there. If you don't know that and you're reading this book, somebody need to bust your ass in the back of the head with a brick or a bat or something. Genitourinary renal conditions. Get that mind right. This section presents an overview of some of the most common genitourinary renal conditions. It also discusses dialysis and catheter management. Genitourinary or renal conditions can result in life-threatening complications if left untreated. These conditions require the EMT to perform an accurate patient assessment, provide prompt emergency care, and transport the patient. Urinary tract infections. Urinary tract infections, or UTIs, can affect the urethra, bladder, ureters, and kidneys because that's your whole, system. They can also affect the prostate in men. They are most frequently caused by bacteria that enter the urinary system via the urethra. Women, especially those who are pregnant, elderly patients, immobile patients, catheterized patients, and diabetics are prone to urinary tract infections. However, anyone can contract a UTI. Common signs and symptoms of a urinary tract infection include abdominal pelvic pain or tenderness, blood in the urine. Another word for that is, or the medical term for blood in the urine is hematuria. Hema or hemat is, of course, blood, urea, urine. Urine with cloudiness or foul or strong odor. Pain or burning, that might just be the cognac, nigga. Pain or burning with urination or sexual intercourse. Frequent or urgent need to urinate. Genital or flank pain. All right. We ain't done yet. My fault. Other signs and symptoms of a UTI include fever or chills, nausea, vomiting, altered mental status. That's the last thing. Kidney stones. Kidney stones or renal calculi. Calcium, all right? Renal, of course, kidneys. Are crystals of substances such as calcium, uric acid, struvite, and crystine that are formed from metabolic abnormalities. They most frequently occur in men between the ages of 20 and 50. Other risk factors associated with renal calculi include family history, hyperparathyroidism, recurrent UTIs, sedentary lifestyle, just sitting on your ass, dehydration, and obesity. Renal calculi are believed to originate in the kidneys and must pass through the rest of the urinary system to be eliminated from the body. Severe pain can occur with renal calculi. I ain't never experienced it, but I heard the shit was real. I don't want nan day of renal calculi, kidney stones, especially if the stone is large and is passing through a ureter. Woo! If left untreated, renal calculi can lead to loss of kidney function, obstruction of urinary tract, or kidney damage. The reoccurrence of kidney stones is common and can occur in up to 50% of patients who have had them. Common signs and symptoms of kidney stones: abdominal pelvic pain or tenderness, flank or back pain that is colicky and severe, groin pain, abnormal urine color, pain with urination, frequent or urgent need to urinate, fever or chills, and of course nausea or vomiting, because that's with damn near everything. B. Asterisk. Bitch, please. You know who I be. Nothing else. None other. The number one stunner. Nigga. I flip, woo. Ball, toss, flip, woos. Show them bitches no love. Ride to G-Lac on dubs, ounces, quarters, halves, bricks. Nigga, I done sold all that shit soon as my tour stop. Bought 5 Bentley Zoras, drops. TVs, must. Buttons, must. CMB, platinum, plus. What the fuck? Hold on. Everybody get your motherfucking roll on. Oh, man, that verse deserves a goddamn Grammy. All right, we talking about kidney failure now. I had to wake up. Kidney failure. Kidney failure or renal failure occurs when the kidneys fail to function adequately. During this condition, the kidneys are not able to filter the waste and maintain homeostasis as they normally would. Kidney failure is normally classified as either acute or chronic. Acute renal failure, ARF. ARF! Acute renal failure. Remember that shit. Acute renal failure, ARF, all right, ARF, normally occurs over a period of days and often results from a significant decrease in urine elimination. Some causes of acute renal failure are decreased blood flow to the kidneys, trauma, cardiac failure, surgery, shock, sepsis, and urinary tract obstruction. This condition is sometimes reversible, but many patients will require dialysis, all right? Chronic renal failure, CRF, normally occurs over a period of years and symptoms range from mild at first to severe kidney failure. The causes of chronic renal failure are numerous. However, diabetes and hypertension are linked to a majority of the cases. Chronic renal failure results in an accumulation of waste products and fluids that can affect almost every organ system in the body. This condition is permanent and life-threatening. Patients with this type of kidney failure ultimately will require dialysis or a kidney transplant for survival. Some complications that may result from kidney failure are pulmonary edema, cardiac tamponade or pericarditis, electrolyte and other metabolic abnormalities, cardiac dysrhythmias, congestive heart failure, hypertension, infections, hemorrhage, liver failure, altered mental status, seizures, and uremia. Uremia. Let's pause it. We gotta pause it. I don't know what the hell that is. Yeah, they thought they was just gonna slide that shit on and it ain't gonna work. It ain't gonna work. Uremia. All right. Uremia is the condition of having urea in the blood. Urea is one of the primary components of urine. It can be defined as an excess of amino acid and protein metabolism in products, such as urea and creatinine, or maybe they just meant creatine. I don't know. In the blood that would be normally excreted in the urine. All right. That's what uremia is. Uremia is a condition of having urea in the blood. Urea itself is one of the primary components of urine, and it can be defined as an excess of amino acid and protein metabolism of products such as urea and creatine in the blood. All right. Yeah, because they had me throw it off for a minute. I'm like, man, what is uremia? They thought they were just going to do that to me like that. They ain't even breaking this shit down. Common signs and symptoms of kidney failure. Abdominal, pelvic, or flank pain, of course. Blood in the urine or stool. Altered mental status, edema of the feet, ankles, and legs. Decreased urine output or cessation of urination. Hypertension, swelling, or easy bruising. Anorexia, and tachycardia. Let's talk about this dialysis. Dialysis is an artificial process used to remove water and waste substances from the blood when the kidneys fail to function properly. They basically function as your kidneys when your kidneys can't complete the task. It generally works through osmosis and filtration of fluid across a semi-permeable membrane. In general, the blood containing waste products passes one side of the membrane while a dialysate, or special fluid used for dialysis, passes on the other side. When this occurs, the water and waste products travel from the blood across the membrane and into the dialysate, thus removing the waste from the patient. There are two major types of dialysis. You got hemodialysis and you got peritoneal dialysis. In hemodialysis, a dialysis machine, if I say dialysis one more damn time, that's like 5 times in a short period right there. Let's see. There are two major types of dialysis. One, hemodialysis and peritoneal dialysis. Those are the two. In hemodialysis, a dialysis machine containing a dialysate is connected to an access site on the patient. All right, a dialysis machine containing the dialysate is connected to an access site on the patient. The access site may be a shunt, a fistula, port, or a graft. Those are 4 different things: shunt, fistula, a port, or a graft. The patient's blood, which is heparinized, is pumped through the access site and into the machine to have the waste removed. The access site should be treated with care because dialysis cannot occur without it. The EMT should not take the blood pressure of a dialysis patient on the side of the patient's access site. Oh, shit. The EMT should not take the blood pressure of a dialysis patient on the side of the patient's access site. You got that? All right. Ain't gonna say shit no more. Hemodialysis is commonly performed at an outpatient dialysis facility. But, that's like however, can be performed in other locations. Okay, that's not saying anything. I thought it was going to say it can be performed at home, but it didn't say that. So don't remember that. In peritoneal dialysis, the dialysate is run through a tube into the patient's abdomen. You got that? You got that. Let me go back. What did it say? All right. In hemodialysis, a dialysis machine containing the dialysate is connected to an access site on the patient, an access site. All right. You got that? No, nothing in particular, nothing specific right there. With hemo, with with the peritoneal dialysis, the dialysate is run through a tube into the patient's abdomen. All right, that's very specific. So don't forget that. Well, you know what will help you out with that shit? Of course, peritoneal. I just thought about that. Peritoneal dialysis, which is directly related to the abdomen. All right, you got it good. All right, you got the peritoneal space, which is in the abdomen. So don't sleep. The peritoneal membrane functions as the semi-permeable membrane during peritoneal dialysis. The fluid remains in the abdomen for several hours so it can absorb the waste and then is drained out of the body through a different tube. Peritoneal dialysis is commonly performed at home and is often performed while the patient is sleeping at night. Other peritoneal techniques can be used during the day. Although dialysis provides a necessary treatment for patients with kidney failure, it has risks that can result in adverse effects and life-threatening complications. Although dialysis provides a necessary treatment for patients with kidney failure, it has risks that can result in adverse effects and life-threatening complications such as hypotension, muscle cramps, peritonitis, especially in peritoneal dialysis, nausea and vomiting, hemorrhage, especially from the access site, infection at the access site, irregular pulse or cardiac arrest, difficulty breathing. In addition to these risks, patients may experience life-threatening problems if they miss their dialysis treatments. Duh. The most common problems are weakness and pulmonary edema. The most common problems are pulmonary edema and weakness. The most common problems are weakness and pulmonary edema. All right, dialysis emergency management. Management of a patient with a dialysis emergency involves the following. Of course, you're going to maintain the airway, breathing, and circulation, ABCs. Support ventilation if as needed. Provide high concentration oxygen. What you're going to do for a dialysis emergency patient, you're going to provide high concentration oxygen. Don't forget. Stop any bleeding from the shunt or access site as needed. Position the patient. If the patient has signs of shock, place him in a supine position. If the patient has pulmonary edema, place him upright. And transport, lastly. Of course, urinary catheters. As an EMT, you may encounter patients who have urinary catheters. There are various types of catheters that serve to collect urine when the patients are not capable of eliminating it themselves. Foley or indwelling catheters, indwelling, that tells you what the fuck that is. Catheters are the most common. Those are the two most common, Foley or indwelling catheters. These catheters have a balloon that is inserted into the urinary bladder via the urethra. The urine drains from, turning the page, the bladder into the catheter and is deposited into a bag. Suprapubic catheters work in a similar way. But instead of being inserted through the urethra, they are placed into the urinary bladder directly through the patient's abdominal wall. Patients with catheters are prone to infections and device malfunctions. That makes sense. Urinary catheter management. It may be necessary for you to assess and transport patients with catheters. During your assessment, be sure to note any swelling, redness, pain, unusual odor or color, or bleeding around the site. Before you move and transport the patient, you should drain the bag. Before you move and transport the patient, you should drain the bag. Record how much urine was in the bag and the time that you emptied the bag. Make sure that there are no kinks in the device and make sure that there are no kinks in the device and that it is free from anything it could get caught on before you move the patient. After transferring the patient to either the cot or the bed, make sure that you lower the bag so the urine can freely flow into it. But at the same time, after transferring the patient to either the cot or the bed, make sure that you lower the bag so the urine can flow freely into it because you don't piss up, all right? You know that. Come on. Shit. Assessment-based approach. Genitourinary renal emergencies. You're going to do your scene size up, and during your primary assessment, the patient having a genitourinary or renal emergency should be categorized as a priority for transport if they meet any of the following criteria: poor general appearance, unresponsiveness, responsive but not following commands, severe pain or shock. All right. And during your secondary assessment, during your history, or, you're going to ask these things here. What are the signs and symptoms the patient is complaining of? Let's see. Do the signs and symptoms seem to get progressively worse or better? I don't know. How long has the patient been sick or suffering from these signs and symptoms? How long, sir? Was the onset of signs and symptoms gradual or sudden? Did it come fast or was it slow, sir? What was the patient doing prior to the onset of the complaint? Does the patient have any known allergies to medications, food, or other substances? Let's get through this. When did the patient last have something to eat or drink? What did he eat or drink? What medications, prescriptions, or non-prescriptions is the patient taking? What is the patient's past medical history? When was the patient's last menstrual period? Is there any genital pain or discharge? Is there a change in urine? Does the patient receive dialysis? Does the patient have any abdominal, pelvic, or flank pain? Has the patient had any nausea or vomiting? Does the patient have any pain associated with urination, defecation, or sexual intercourse? Signs and symptoms. The signs and symptoms associated with the genital, urinary, or renal emergency will vary depending on the cause, of course. They may include the following, though. And they all damn near the same, but we're going to run it again. Urine with an abnormal color, consistency, or odor, abdominal, pelvic pain or tenderness, nausea and vomiting, fever or chills, syncope or altered mental status, pain or burning during sexual intercourse, urination or bowel movement, flank, groin, or back pain, frequent or urgent need to urinate or decreased urine output, blood in the urine, hematuria is what that's called, edema of the feet, ankles, and ankles. I'm reading too fast for myself. Edema of the feet, ankles, and legs. Hypertension, anorexia, tachycardia, signs of shock. And remember, you're not going to sit there and try to guess what any of that shit may be or may not be. You're going to transport them immediately. Emergency medical care, of course, your ABCs and, breathing, and all that good stuff. And if you need manual inline stabilization, you're going to do that. And stay calm, all right? And initiate quick and efficient transport and all of that good stuff. And that there, folks, includes whatever the hell we were talking about. I don't remember exactly the specific of it, but it was genital, urinary, renal emergencies and gynecologic emergencies, those two, all right? Learn it, read it, listen to it, study it, and get your shit right, When you get in front of that question, you want to be able to knock it out, yeah. All right now, later. Get Bentley on the sticker to show the price. On mama when it just to floss my eyes. Fresh, wait, hold up.